Hi everybody, I'm Rod Thompson and this is Medicare for All. This is a brand new blog and it's designed to do one thing: support the people who are trying to make Medicare for All work. There are a lot of reasons why Medicare for All has become of age. It's time. We've been screwing around since the 50s trying to get Medicare for All, trying to get everyone into the healthcare system. Each time we've been thwarted by people who want to make sure that the capitalist system keeps on making money off of us. It's not a good model. If you're over 50, you know what I mean. You've taken a look at what your healthcare premiums are, and they're more than your house note. It's obscene. It's obscene. Now, Bernie and a lot of other politicians have finally signed on, and they're going to make it happen. Believe me, 2020 is our goal. It's time for Medicare for All. Now, what are some of the major complaints about going forward with this? Well, I'm sure you've heard them. The number one argument: I love my Medicare, but Medicare for All, that's communism. You've heard it. It's ridiculous. It's absurd. If Medicare for the senior citizens is not communism, then why is Medicare for All communism? It simply doesn't make any sense. Every other civilized country has a healthcare system that costs you nothing out of pocket. Yes, it means your taxes are higher, but because your healthcare bill is so low, you end up paying far less even with the higher taxes. That is so simple to prove. Now, I want you to do a little homework for me. Take a look at Dean Baker on Patreon. I don't agree with everything he's saying because I don't think that his article was well enough researched, but I do agree with a lot of what he says. He points out that even the right-wing think tank that came up with the numbers to say that Bernie Sanders' plan wouldn't work, even those people inadvertently proved the opposite was true. That, in fact, even using their numbers, Medicare for All is going to be less expensive. Now, it's going to be dramatically less expensive the more profit we can wring out of it. That's not in the best interest of the rich billionaires and capitalists. That's not in the best interest of the people who are the board of directors of the hospitals and pharmaceutical companies. But we don't care about those people. They've been profiteering and leeching off of us for too long. Let's clear the table, clear the decks, and make Medicare for All. Now, we're going to discuss all of this little by little and take each issue one by one. One of the issues is reforming Medicare as it is. There's too much profit in Medicare as it is. Take a look at the drug situation. Senior citizens in the donut hole, it's obscene. It's ridiculous. So we're not just going to look at Medicare for All. What we're going to try to do is reform healthcare once and for all in America by getting the most people to weigh in. That's what this is for. The time is now. The time is now to act. And by the way, one of the things we have to understand is the present system makes us stick with a particular job because of our health care, and that's wrong. You shouldn't have to stick with a job just because you're afraid of losing your health care. We've got to divorce those two situations so that those of us who want to be able to freelance do not get penalized and have to pay 10 times as much as the people who are in a nice, cushy job in a nice corporation. That discrimination has to end. You also want to take a look at what's been written about healthcare and how it works in America. Please educate yourself and educate the people around you, and we will make this work.